Hi everyone, and welcome back to the Medical News Update. In this episode, we're going to be talking about the impact of ultra processed foods on cardiovascular health. In recent years, the popularity of plant based diets has surged, driven by growing awareness of the environmental and health benefits of reducing meat consumption. However, not all plant based foods are created equal. While whole foods like fruits, vegetables, legumes, and nuts are celebrated for their health benefits, ultra processed plant based foods might not offer the same advantages. Emerging research suggests that these ultra processed alternatives could, in fact, increase the risk of heart disease and mortality. Ultra-processed foods are industrially formulated with ingredients not typically found in home kitchens, such as modified starches, hydrogenated fats, protein isolates, and artificial additives. These foods often come in the form of ready-to-eat meals, snacks, and meat substitutes. While they provide convenience and cater to the growing demand for plant-based options, they may also come with significant health risks. Previous studies have begun to uncover the potential dangers of consuming ultra processed foods, even those marketed as plant based. These foods often contain high levels of salt, sugar, and unhealthy fats, which are known contributors to cardiovascular disease. A study published in the journal BMJ in 2019 found a strong association between the consumption of ultra processed foods and an increased risk of heart disease. The research highlighted that each 10% increase in the proportion of ultra processed foods in the diet was associated with a significant rise in the incidence of heart disease. In addition to heart disease, ultra processed foods have been linked to higher mortality rates. A study published in JAMA Internal Medicine in 2019 reported that higher consumption of these foods was correlated with an increased risk of all cause mortality. This study found that individuals with a diet high in ultra processed foods had a 14% higher risk of dying from any cause compared to those who consumed minimal ultra processed foods. A recent study published in 2024 in Lancet has some interesting findings, especially for those following plant based diets. The study reveals that while plant based diets are generally associated with lower cardiovascular disease risk, the benefits are significantly influenced by the degree of food processing. Plant sourced non ultra processed foods are linked to lower cardiovascular risk, whereas plant sourced ultra processed foods are associated with higher cardiovascular risk. This research utilized data from the UK Biobank involving 126,842 participants aged 40 to 69 years. The participants were aged 55.9 years on average, with 57.1% being female. The study included a diverse range of ethnic backgrounds and socioeconomic statuses. The study followed these individuals for a median of 9 years, analyzing their dietary habits through at least two 24-hour dietary recalls. The study showed that every 10% increase in the consumption of plant sourced, non ultra processed foods was linked to a 7% reduction in cardiovascular disease risk and a 13% reduction in cardiovascular disease mortality. Conversely, a 10% increase in plant sourced ultra processed food consumption was associated with a 5% increase in cardiovascular disease risk and a 12% increase in cardiovascular disease mortality. The study highlights that the degree of food processing plays a critical role in the health benefits of plant based diets. Ultra processed foods, even if plant based, often contain high levels of unhealthy fats, sugars, and additives, which can negate the cardiovascular benefits typically associated with plant sourced diets. As an observational study, causality cannot be definitively established. Furthermore, dietary recalls depend on participants' memory and honesty, which might introduce some inaccuracies. One might wonder why plant based ultra processed foods could be harmful. The issue lies in the processing techniques and added ingredients, which can negate the potential benefits of plant based diets. For instance, many plant based meat substitutes are rich in sodium and saturated fats, which are detrimental to heart health. Furthermore, the high level of processing strips away many of the natural nutrients found in whole foods, such as fiber, vitamins, and minerals, which are crucial for maintaining a healthy heart and overall well being. While the convenience of ultra processed plant based foods can be appealing, it's essential to prioritize whole, minimally processed foods to reap the full benefits of a plant based diet. Focus on incorporating a variety of vegetables, fruits, whole grains, legumes, nuts, and seeds into your diet. These foods are naturally rich in nutrients and fiber, which support heart health and reduce the risk of chronic diseases. Thanks for listening to the Medical News Update. Remember, not all plant based foods are created equal. For better heart health, focus on minimally processed plant foods. For more on this study and other health updates, subscribe to our podcast.